Hi, my name is Sue McWilliams, and I teach at Northern Arizona University School of Nursing. And I've been a nurse for 40 years.
Wow. So I see that you're not in your office.
Nope, I'm working from home.
And how has that transition been for you?
Well, it's been a struggle, and partly because I transitioned to home fairly quickly because I have my mother-in-law living with me, and she is in her late 70s and has chronic lung disease and rheumatoid arthritis, and just got out of the hospital the end of January with a really bad case of pneumonia. So she's been living with us since then. So when things started to really kind of get crazy with the virus, I stopped going up to school. So that was around March 14th. So I've been at home since then.
And what type of classes do you teach?
So I teach what they tell me to teach, but typically I teach a gero and palliative care clinical rotation. So that's a 16-week course, and we take students out into the community to work in senior centers, long-term care facilities, and then they also do a rotation with palliative care and hospice. And then I do the final preceptorship course for our traditional and our accelerated students. I teach that one. And then I teach an intro to nursing as a profession. I've done that both for our traditional students, and then this summer I'm teaching the accelerated students. And that's for the accelerated students, it's supposed to be a 3-week course. It's supposed to be in person, and it's moved all online. So I had to transition that. And then I teach public health for our concurrent program students online over the summer. And it's one of my favorite courses, so I love doing that. And then, whatever else they ask me to teach, I'm happy to teach.
So you transitioned from working from home. What about your students who were out on practicums? How'd you deal with all that?
So our accelerated students were supposed to be starting their capstone clinical rotation, and I do all their placements. So I do all the placements for the undergraduates for their final capstone. And we were in our first week of their course, and the next week they were supposed to go on spring break. And I basically told them, guys, I think if you're not traveling, and I highly recommend you don't travel, that you work through spring break, get your clinical hours through spring break. And that was on a Monday. By Friday, all of our clinical sites had canceled except for one. So I was scrambling to try and figure out what to do with these students. We were really, really fortunate that one of our hospitals, which is in sort of a rural area for us, had not been impacted by the virus. And so they were very happy to take students. And they took, I think they ended up taking about 15 students for them to complete their capstone. And then the rest of the students, I was able to work with our health department, and they actually went and did testing with the health department. And so they were in 2 different locations doing COVID-19 testing.
So what has been your biggest challenge?
Well, a couple of things. My biggest challenge is right now I'm supposed to be getting ready for placements for my fall students who will be graduating in December. We've been told that we may start school 2 weeks early, which means that all of our contracts will change because we aren't supposed to start until the 24th of August. And I don't know if the hospitals are going to be ready to take students. They're anticipating maybe an August 1st start date. And so I don't have answers for students who are emailing me and saying what's happening and what should I do, because I'll have students in Flagstaff, and then I'll have a large group of students that go down to Phoenix area, and because that's where they're going to move when they graduate. So my role when I place them in their capstone is to match them up with a hospital system that they want to work for. So I'm trying to get them in the door so that they have a job when they graduate. Um, and so I work very closely with the students in figuring out what it is they want to do when they graduate and where they want to go. And if they moving out of state, okay, great, that's good. Let's just get you a nice experience. So, so I have students who are looking to figure out what they're going to do with their lease, because if they're going to be going to Phoenix for their capstone, they don't want to keep their lease up in Flagstaff because they're not going to be staying. Some of them are just trying to figure out, you know, what's going to happen in the fall, and are they going to have a capstone rotation? And it's very hard for me to tell them that I don't know yet. I really don't know what's going to happen.
Do you have any students who are second guessing their career choice based on what's occurring? Have you had those conversations?
No, I don't, you know, it's really interesting because our gero palliative care students who finished up the semester, mostly virtually. I mean, we gave them case studies and things like that to finish up their last few weeks. Part of their classes, they write a journal every week. And a lot of them experienced hardship. I had a couple of students, one who had to go back to Hawaii because her mom had to go to the Philippines because her dad had died. And her mom got stuck in the Philippines. And so she had to stay in Hawaii to take care of her brother. And then I had another student whose parents were insistent that she return to Alaska because they were so afraid. And so she went back to Alaska. And another student who was stuck in California because they got locked down really quickly. And all of them in their journals, even though they talked about the struggle that they were going through, they really have a desire to be a nurse. So I don't know that this has caused any of them to second guess their career. I think when I know for this accelerated students who started May 11th, I had 2 students who had to drop out in the first week. One because she's living on the reservation, and she has limited access to the internet. They're on a strict curfew over the weekend. They're not allowed to travel at all, even on the reservation. And another student whose family business went under, and that was going to kind of keep her in the program. That's what was going to afford her to be in the nursing program. So yeah, there have been tremendous hardships. I also know that some students who are hoping to start working at our hospital system in Flagstaff have been told they're not hiring right now because they have so many COVID cases. They just can't take in a new cohort of new graduates. So they're looking for jobs, but I haven't heard anyone say, I don't want to be a nurse anymore. I think students that are out there that have been working now for a couple of years might be second guessing themselves. But I think for our new graduates in that, there's still a huge desire to keep in the program.
What about you? How is this questioning your career path?
Well, it's a little scary right now because NAU has announced that they are going to be implementing furloughs and pay cuts, and we will not be seeing, and I actually have a 10-month contract because I am the undergraduate coordinator, so I deal with all the student issues and things like that, and we're told that we're only going to be getting a fall contract. So because they're anticipating some huge hits to the budget because of decreased enrollment. Now, fortunately for us in the School of Nursing, we have a lot of kids that want to be nurses. And so we always have lots of people applying to the program every year. So I don't know that we're going to see a huge hit because I know for fall, for sure, we have a full cohort. And we already have we'll be taking applications in October for our spring. And usually we get about 600 students who come in as freshmen and declare nursing as their major. So I think that we probably won't see it, but it's still a little bit scary to think that, wow, this pandemic is hitting every fiber of our economy. So yeah, so that's a little bit scary. And I haven't practiced nursing in 4 years since I moved here to start teaching at NAU. I moved here from Illinois. And before I moved here, I'd actually started an urgent care center with a friend of mine who's an ER doctor. And so we'd opened up an urgent care center, and I was, running that and practicing. But I was ready to kind of step back and not work as hard. So, so now it's kind of like, well, maybe I need to start looking at other alternatives. I did just finish my doctorate. So I completed that and graduated this May. And my goal with that was really to start consulting. I did a project with a residential treatment center in Utah on compassion fatigue in the family caregiver for adolescents with mental health disorders. And I really was hoping to be able to kind of take that and start consulting with other programs, not just for adolescents, but for families who care for someone with a mental health disorder, because it's not anything that anybody talks about. We don't talk about the fact that, this is a very stressful role as a caregiver for someone. And I know it personally because I have a daughter who suffered from mental illness since she was 12. And so it's like, oh, well, this is a big gap. And so I was kind of hoping to be able to kind of do a little bit of consulting with that, but that's kind of been put on hold. I know the treatment center that I was working with has pretty much locked everything down because of the virus. They're not having any family programs at all this summer. We actually have a program in Prescott Valley that has 118 cases of COVID on their campus, and it's an all-girls school. And so they got hit really hard. So I just understand that this is probably not something that'll happen until, we get this thing under control. But it is a goal of mine to work with family caregivers.
How is this event going to shape nursing in the future and really focus nursing as far as long-term residential?
Right. And I've actually talked with my accelerated students in this class, and, I told them, I said, this is a really scary time, but it's also a time for nursing to really step forward and insist on changes and take the leadership role in changing healthcare. I remind them that there are 4 million of us out there, and we could have a very powerful voice. But we need to start looking at this whole process and seeing what are the outcomes, what has really been the biggest hit for nursing. And I think one of the things we recognize is that we don't have resources. Nurses who thought they had a job and would never have to worry about it saw themselves, being let go because we weren't doing any elective kinds of procedures. So what is it that we can do that support healthcare, but are not tied to the fact that if we can't do elective procedures, we don't have jobs. So I think we're going to need to look for more ways we can work within the community. That maybe healthcare needs to shift. And we've talked about this as faculty too, that maybe, the shift really needs to be out of inpatient and more in the home setting. And how can we take care of people in their home and their community and provide healthcare that way? So I do see that we as nurses will have some huge opportunities here. So I'm kind of excited about that. I mean, I do think in all disasters, some good comes out. I don't know what it's going to look like yet, but I'm hopeful. I try to have hope every day that we'll see new ways of doing things. And I'm really hopeful that nursing is going to step up and take some real leadership role in this.
I loved the idea that out of the ashes, great things happen. What have you learned personally about yourself through this event that you didn't know you needed to know before?
Well, it's been a journey being at home full time because I don't, I have a job and I don't go up to the university every day, but I'm up there frequently, 3 days a week at least, minimally. My partner, he works out of the home. So I understand what it's like for him because you do tend to get isolated very quickly. And it's just because your day is very full. I mean, I'm still teaching, still doing things. So it's not like I'm just kind of like sitting around doing nothing, but you do find all of a sudden that you are in a very small world, and how do I keep myself connected to the outside world? And it's really easy for days to go by and think, oh gosh, I really haven't talked to anybody. I need to like reach out to somebody, so making sure I stay connected with friends and family, and and being really disconnected with my kids. I have two kids that are still in Illinois. They're both frontline. I have a daughter who's a firefighter paramedic in a city just south of Chicago, and they've been hit very hard. And then a daughter who's a patient care tech and who's graduating from nursing school in August. And she's been working in an ER in a very busy area where they've been hit very hard. And then my son is in Denver, and that's kind of scary because he's with his, friends, going to school, and it's kind of like he's out there. And then I have my one daughter is living here. She lives close by, so I can kind of keep tabs on her. But that piece is like, it's like you just realize how all of a sudden you're just by yourself some days, and just making sure that I'm reaching out and still keeping connected with other people. It's been a challenge too. Like I said, my mother-in-law is living with us right now, and she is not in the best of health. I think she's got early dementia. As a healthcare provider, I'm picking up on all these little things, and that's kind of stressful for her son. So, just trying to make sure I remind him that maybe some of her behaviors are not things that she would intentionally do. So living in that very close quarter. So the whole concept of compassion fatigue, which was my doctorate project, I get it on a lot of different levels. So
you're an educator, you're a mom, you're a wife, you're a daughter. How are you keeping it all together?
Well, I have a really strong personal sort of way of doing things. I mean, I have practiced and studied meditation for 5 years now, and that's really helpful. I run, and we either run locally here or we go up into Flagstaff and run on the forest roads. I don't run a lot long distance. I run 4 or 5 miles. That's really important. I tell my students 2 hours of nature every week is really good for the soul. So, being outside and that's really important. And like I said, just trying to keep connected with the outside world, because I know it's really easy to become isolated, and that's when things can get really hard for people. I think that's why you see a lot of people with anxiety and depression, because they're not used to this sort of being with themselves a lot. Most people you don't have to sit and think about yourself a lot, when you go to work every day. But when you're home all the time, all of a sudden you're like with yourself a lot. So I think for me, I think that's been really important to try and keep those things going forward. And I'm hoping that we're going to be able to go back to campus in August, at least somewhat, so we can kind of get connected with school again. But if not, trying to figure out how to make Zoom meetings and that not as draining. I know the other day I had like 3 different Zoom meetings, and by the end of the day I was like, my brain was like just overwhelmed. I mean, it's like, okay, this is not normal, but might be the new normal. We may have to learn how to adjust to it. So and getting my students to see that this is a way that they can still stay connected as well if we're not going to be on campus together.
Have you identified any educational gaps for curriculum development and change, other than everybody needs to know how to use Zoom better and technology? What's really speaking to you that you're seeing as far as the gaps?
Well, I think one of the things that's become real apparent is that we don't have a really good way to teach skills unless we can touch and feel patients and talk to patients and come into a lab and even practice on a dummy. So I think that's been a real eye-opener, and I don't think people really I mean, I know we sort of talked a little bit about what the future might look like, to train doctors and nurses, using virtual simulation and things like that. But I don't think we were really prepared that that is something that we need to consider as part of our ongoing curriculum. I think virtual simulation is going to be something we're going to need to seriously look at going forward, and partly because we have an issue here in the state of Arizona that we don't have enough clinical sites for all of the nursing programs. We have a lot of nursing programs here, and just trying to make sure that everyone can get a slot becomes a real challenge. And so how do you meet that need? Because hands-on is how nursing has always been taught. I mean, I know for me, that was how I was taught. I mean, I spent a lot of hours in the hospital taking care of patients. And even then, I still needed to learn a lot once I graduated, the whole novice to expert thing. So that, I think, is a big piece that we don't have our arms around yet. And how are we going to manage that going forward? And then I think the other piece to it is making sure that we're preparing our nurses for the real world. So I'm going to be interested. I have had a couple conversations with some of my students that graduated a year ago. Reached out to them to kind of figure out where they're all working and what they're doing. And one of my students said, yeah, it's been really hard because this wasn't kind of what I thought it was going to be like, taking care of COVID patients. And it's been a real challenge, and I just feel kind of stressed a lot. So I do worry that our new nurses that are out there are gonna burn out a lot faster than the burnout rate that we see. And are we doing things to support them? I think the American Nurses Association has done a great job of sending out, because I get emails from them every day, checking in, how are things going? Here's what we know, what's going on for you, tell us about your hospital system, so I think they are doing a really great job, but not every nurse is a member of the ANA. And so, are we doing enough to support our nurses out there? So I think we need to really make sure that we're training them to be resilient. So, and that's one of the things that I know I've talked about with these new students that are coming into our accelerated program is, you guys are going to need to find ways to keep yourselves healthy, try not to stress too much. It's a very stressful program. It's a 12-month program. We, they work them really hard for an entire year. But these are amazing students. They're the ones that we just graduated. I was so impressed with their willingness to just do what needed to get done so they could get their contact hours in. I actually have one student who we ended up really working hard to find her final clinical placement. She had breast cancer, newly diagnosed, was supposed to have surgery. The virus hit, they stopped all elective surgery, so she couldn't go in and have her procedure done. So they started her on her chemotherapy, and we didn't want to put her in a hospital setting. So we did find some really good virtual simulation for her to do. And then we got her hooked up with a clinic, a family clinic in Flagstaff. And she was doing telehealth and working with their chronic clients and making sure that they were doing okay. And they actually hired her to do care plans for them, for their chronic, disease patients. So, so they were just an amazing group, and I think that's the one thing about nurses, we just keep moving forward, sometimes maybe to a fault, but, so I think that's one of the things that we need to really look at is, how do we teach that resiliency to our students so that we don't burn them out if something like this happens again. And I hope this never happens again, at least in my lifetime.
Do you feel that you've been supported by coworkers? Are those bonds stronger now? Are they more difficult?
I have some really close coworkers, that, and that's been great, that we can just kind of like call each other on the phone and just talk about what's going on. And so that's been really helpful. Pam has been great. And, she's been like willing to like just chat and, which is a lot for her, especially since she's winding down her role as our director. And I know she's had a lot on her plate. But she's been really good about trying to keep in contact with everyone and make sure we're all doing well, and what could she do to help support us. But it's kind of hard. We do sort of, in the summer, typically we all sort of go our own way, and some of us are teaching and some of us are traveling, and so typically we sort of like, it's kind of like there's like, okay, well, we're all on vacation now and we'll all come back together in the fall and catch up. But now it's sort of been like, okay, there's a couple of people that I'm like making sure let's keep in contact, because this is not going to just be over. And we know the fall is not going to be the same. We're not going to have our big welcome back week where we all get together and see each other from even all our remote campuses, and it's all going to be done virtually. And so, it's going to be important for us to keep really connected and finding ways to stay connected. And I think that'll be important for our students too, that we're all still really connected.
Do you see that there's a disparity in healthcare students and their abilities to move forward? You mentioned a little bit early on, I know you guys have a lot of students that are impacted that you're working with on the reservations.
Mm-hmm. Yeah.
What's the future plan for those? How have any ideas to support that?
I think, I don't know what is really being done to provide support. I know we've done some stuff for our students that are out on the reservation. I mean, the university has gone out and put repeaters out everywhere so that they can have increased internet access. But I think for them, it's going to be really difficult. The Native American population in Arizona has been hit so heavily with the virus. I'm concerned that some of our students won't come back in the fall because of family issues and the need to be at home and take care of siblings. And so I'm concerned about that. And I don't know that we really have any way to provide them with a lot of support. That concerns me. I'm concerned about students whose, families, like the one whose family's business went out and now she has no way to go to school. And so I haven't heard from students yet about what their needs are. And my plan is, because I do need to start connecting with them about fall, is to kind of figure out where everybody's at. I'm hoping that they're taking advantage of some of the financial aid that's out there. I mean, I do know that we got money from the CARES Act that will provide scholarships for students and grants for students so they can continue going to school. But I do worry. I mean, I think about my students who are separated from their families and haven't been able to go back home, or went home and now they got to think about coming back, and what's that going to look like? And, do you need to get back sooner rather than later, because you may need to quarantine yourself for 2 weeks before you start school? So, I mean, I am concerned about our students and their welfare and what's going to happen and how many of them are out there suffering and, what can we do to support them? So a lot of what I'll do over the summer will be kind of reaching out to those students who are supposed to be coming back in August to find out, what's going on, what can we do to help, is there, anything in particular going on that we can do to help support you? I know there's always a big, huge need at the university, and they've talked a little bit about it, that we have students that don't have enough money to buy food. So we have a huge food pantry for students, but that's based on whether or not we can open up, all of our venues for students to come and get food. I mean, my concern is that the union, which is the main place where kids go to eat, isn't going to be able to reopen because we can't provide social distancing and things like that. So so there are a lot of concerns for students. and what they're going to do. I mean, I was talking with my son, who's in the process of trying to find a house in Denver for him and three other buddies, for the fall. So they've been looking, and he's the only one in Denver. The other guy's in Illinois, and two guys are in New York. And so he's running around trying to find a place to live, because he's been, sharing a place with one of his friends. But that's kind of wasn't supposed to be a permanent thing, but it kind of got to be a permanent thing because of the virus. And so, that's going to happen with students. They're going to be stuck places. Mm-hmm. So trying to figure out how we're going to, navigate what will happen with our students in the school, I think is going to take a lot of creative thought on everybody's part.
What was the rationale to start classes 2 weeks earlier? I'm just interested.
I think their thought is that we'll have a second wave, and they want to have all the students home before the second wave and flu season hit here in Arizona. So we would be done by Thanksgiving. So I'm not really sure if that's going to work or not. I mean, we're supposed to hear next week, but that was one of the rationales. It does mean we have to ramp everything up a lot faster, and make sure that students can get back here. That's my concern, is what happens if students can't get back that quickly, because they don't have a lease, or, they don't have a place to live yet. And they were not thinking they were moving in until the end of August. So it's going to be interesting. It's, I learned to take it just kind of day to day,
How do you want history to record this event?
I want them to record this with the truth that we mismanaged this whole problem. I mean, one of the things that I did in my past life was I ran a community health program, and I actually ran an immunization program. And when we had a shortage of vaccine for the flu, I had to give half of my supply to the hospital, and I gave away all my flu shots for free. And we went into some of the critical areas in our county, and I always got concerned that, what if we had a huge outbreak of influenza in one of these sites that we would go to, where we had multiple families living together in confined spaces, and it would be devastating. And I always look to the CDC to be, sort of my guidepost. What are they saying? What do we need to do? What's it look like? What's the flu? I pull up the map and look at the map. And when the coronavirus started kind of rearing its ugly head, I got a call from a friend who I used to work with. She was my staff partner when I was with the American Cancer Society in Illinois, and I was on the advocacy I chaired the advocacy committee. And she called me and said, "What do you think is going on?" She'd worked for Rotary International, had traveled all over the world and into China. And she said, "When I saw this stuff happening," she said, "I just started getting really concerned." And she called me and she said, "What do you think?" And I said, "Well, I think it's going to be really bad. I'm really worried." And that was the first week in March. And we were having this conversation, and we weren't doing anything here in this country. And I want that piece to be remembered. I want to be remembered that we didn't do what we needed to do early enough to save lives. And why did that happen? And what were the reasons why that happened, so that we don't do that again, and we don't make that mistake again. So I mean, I hope we do it right. I'm so, there are days when I try not to be discouraged that we can't get this thing under control, but then I get hope that we have potential vaccines, that we're getting closer to understanding the virus, and that maybe we can have some treatment so that people don't get as sick. I also think it shows us how fractured our healthcare system is in this country, that just because you get sick doesn't mean you get to get care. And that's scary. And I've been fighting that battle for a long time. And I actually, that was one of the fun things that I did in my life, was when I volunteered with the American Cancer Society in Illinois. we went to Washington D.C. and went to Springfield and lobbied and did a lot of work to make sure people had access to health care. And I remember when the ACA was being formulated, the American Cancer Society was pushing very hard to get that passed, because it meant people who had cancer could get care, that they wouldn't be limited by their health insurance plan. There would be no more maximums. And anybody could go and get care. And that was so important. And I think this has showed us that we need to fix this problem in this country.
Any thoughts you want to share with 8th graders who are currently experiencing this and might want to be a nurse?
Well, I think nursing is one of the coolest professions. And I tell my students this all the time. In 40 years, I've done so many different kinds of nursing. And it's amazing what you can do as a nurse. I mean, I started out working in a hospital, but even in that hospital, I did so many different things. I got to start a new program where I got to go out and meet people in the community and give away free immunizations and healthcare, and that was awesome. And I, got to start an urgent care center and build it from the ground up. That was really a fun thing to do. And I've worked for corporations as a nurse, and so there's just unlimited things you can do as a nurse, and you can change so many people's lives by being a nurse, whether it's at the bedside or working in the community, or going to Washington D.C. and talking to your senator about how important it is that people have access to health care. So I think it's a great thing to do. And I think anybody who goes in to become a nurse can do it for a very, very long time. And when they get to the point where they don't want to be out there with patients, then they can come and teach nurses how to be nurses.
Well, thank you. Thank you for taking the time and sharing your thoughts and your leadership, and kind of keeping a cool head when all around you are crazy. Really appreciate what you do, and we're so blessed to have individuals like you who are continuing to move this issue forward and supporting our future healthcare workers. Without you, we just couldn't do it. Thank you.
Oh, well, you're welcome. It was a pleasure.